Whooping cough, medically known as pertussis, is making a troubling comeback across the United States. For the first time in nearly 70 years, the nation is witnessing a dramatic surge in cases, with infection rates climbing faster than at any point since the 1950s. According to the Centers for Disease Control and Prevention, over 8,000 confirmed cases have been reported as of mid-April, more than double the number seen during the same period last year. This sharp increase has placed the country on course for its most severe outbreak of whooping cough in decades, rivaling the 2012 spike that had previously marked the worst outbreak in 50 years. This resurgence is causing growing concern among health officials and medical professionals. The main drivers behind the surge appear to be declining vaccination rates and waning immunity among the population. The CDC's data, released through April 16th, shows a total of 8,077 reported cases nationwide, compared to just 3,847 in the same time frame in 2023. Tragically, at least 4 deaths have already been linked to this year's outbreak. 2 infants in Louisiana, 1 adult in Idaho, and a child in South Dakota who was also battling influenza. The whooping cough outbreak is not occurring in isolation. It is unfolding alongside a resurgence of measles, another vaccine-preventable disease. As of April 18th, the CDC had confirmed 800 measles cases in 24 states, highlighting broader concerns about declining immunization coverage across the country. Medical experts are pointing to a troubling trend. Fewer children are receiving the vaccinations that protect them from diseases like whooping cough. CDC figures reveal that for the 2023-2024 school year, fewer than 93% of kindergartners received the standard immunizations. Among these is the DTaP vaccine, which protects against diphtheria, tetanus, and a cellular pertussis, the bacterium responsible for whooping cough. Dr. David Higgins, a pediatric specialist at the University of Colorado's Anschutz Medical Campus, has emphasized that while measles often captures public attention, pertussis is the illness healthcare providers are encountering most frequently. When we see measles cases, we know vaccination rates have dropped not only for measles, but also for other childhood diseases like whooping cough, he explains. Pertussis is a highly contagious respiratory infection caused by the bacterium Bordetella pertussis. Before the widespread use of vaccines in the 1940s, it was a common and often deadly childhood illness. After vaccines became routine, case numbers fell dramatically, but since the 1980s, they have been rising again. During the COVID-19 pandemic, public health measures and reduced interpersonal contact led to a sharp drop in cases, but now, as those measures have eased, numbers are rebounding. The early symptoms of whooping cough can easily be mistaken for the common cold and may not appear until up to 3 weeks after exposure. As the illness progresses, a severe and persistent cough develops, often accompanied by the signature whooping sound during inhalation. These coughing fits can be exhausting and distressing, especially for young children. Infants and young children are particularly vulnerable to complications from pertussis, which can include pneumonia, seizures, brain inflammation, and in severe cases, death. The CDC estimates that about 1 in every 100 infants infected with pertussis will die from the disease. Vaccines have dramatically reduced the incidence of pertussis, but immunity can fade over time. This means that even those who have been vaccinated can become infected, though their symptoms tend to be less severe and they are less likely to spread the disease. To maintain strong immunity, the CDC recommends a series of DTaP shots for children starting at 2 months old, with several booster shots throughout childhood and adolescence. Pregnant women and adults who were never vaccinated are also encouraged to get immunized. The combination of waning vaccine effectiveness and declining immunization rates has created an environment where whooping cough can spread more easily. Health experts stress the importance of staying up to date on vaccinations to protect individuals, families, and communities from this preventable and potentially deadly disease.